Now, just a little bit about yourself. You've been with the Huron County General Health District.
Yes.
For how long?
14 years. Coming up on 14 years.
Really?
Yeah. Long time.
That really is a long time.
Long time.
Yeah, you enjoy it.
Good organization.
You like working with numbers? Are you a number cruncher?
I dabble in numbers.
Okay.
I do like to work with them. I really like to use them more than do the statistical analysis. I mean, that's part of my job, but I really, really like looking at what they tell us and using that information to make good decisions.
Let me ask you something. Now, I kind of gave you an idea of what we were going to talk about this morning, but can you make numbers prove almost anything? You know, you hear people doing that. I don't think you can. I think if you really have your basic fact numbers that you can't spin them anymore. It's like when you tell us that yes, obesity is still a problem. It really is. I mean, you just can't pick these numbers.
It's good documentation, right?
Yeah, I'm recording.
Correctly, you ask a question that is open-ended. You don't go in with any agenda as to what the numbers will tell us.
Okay.
You can design questions in a way that lead people to
really?
respond in a certain way.
Okay.
So I guess you could cherry pick questions,
Okay.
but once you've designed appropriate questions and conducted it correctly, and you got the sample size that you needed, you get a certain reliability. Like what we have here, 95% of what we read in here we would expect to be accurate and applicable to the whole community, even though not every Huron County person answered the questions.
Very good. Well, now, let's talk about this, and this is a pretty big booklet, the 2011 Health Assessment Report. Explain, first of all, how the whole idea came about.
Okay.
How often you do it?
Yeah, we conducted the last health assessment in 2007. It is a process. First, you have to get together a group of health-minded organizations, and you have to raise the money.
Okay.
That's a process. And then you work toward designing the survey instrument. And we contracted with Hospital Council of Northwest Ohio. They did an excellent job for us. We used them in 2007. We used them again in 2011. And they're really the survey experts.
Okay.
But they have a list of questions, most of which are from something called the BRFSS.
Okay.
That's a CDC survey that looks at adult health behaviors and health status. And then we used youth risk behavior survey questions, or the YRBS questions, with the youth, for the most part. Now there's a little, imagine how complex the process is at the local level. You take it up to a national level, it takes a lot longer and is more cumbersome to develop, to change questions, to add questions on new trends. So we tend to be ahead of the curve there in Northwest Ohio. And so sometimes we can't compare to the state or the nation, but once Hospital Council adds the Huron County website to their data warehouse, we'll be able to compare to other Northwest Ohio counties.
So, briefly then, how do they decide who gets these questionnaires, and do you hope for a certain percentage of return? How does that?
Yeah, we needed to receive 425 adult surveys. No, I'm sorry. We needed to receive 381. We did receive 425.
Wow.
They do well above. Yeah, we had a 55% return rate. For the youth, we needed to receive 363, and we got back 447. That was a 95% return rate. But the youth we did in school, so they're a more captive audience.
I was just going to say, you're a little bit more trapped there.
That's
Fill this out or you're not eating lunch.
That's correct. And they do still look at if someone's just coloring in circles or whatever, those will get thrown out, which is hence the 95% return rate. With the adults, we had a 55% return rate. That was the number we got back from people who received a mailed form and took the time to fill it out.
So we were talking about that yesterday.
Yeah.
It's just not something that you can sit down in 5 minutes and do. You have to read these questions and think about them, and for people to do that and then to mail them back. That really shows a lot of confidence in people here in Huron County.
sure
you know,
does.
give us this information so we can tell you what's going on.
Yeah, it sure does. We're very pleased with that return rate. As busy as people are, as much time as it took me about 35 minutes, I think, to complete that. So we were pleased.
Good. Now, let's talk, you mentioned the Huron County Health Partners. Who's involved?
Okay. The agencies are Huron County General Health District, or the Health Department,
Okay.
Fisher-Titus Medical Center, Willard Mercy Hospital, the Bellevue Hospital, the Huron County Adams Board, Huron County Schools, the Huron County Board of Developmental Disabilities, Christy Lane,
Okay.
Erie Huron CAC, the City of Norwalk, Family and Children First Council, City of Willard, Firelands Counseling and Recovery Services, and the Village of New London. So pretty good cross-section
I was
of
going to say,
agencies.
yeah, exactly. So everybody has some input there from different areas. That's great. How often do you meet?
To put this together, I would say we probably met 8 times,
Really?
10 times
Okay.
to put this together. That's phase 1,
Okay.
is doing the health assessment.
Right.
Then this is supposed to guide us in what comes next. What can
Okay.
we do to make improvement for the health of the people who live here?
Okay.
And that's a community health improvement process that will begin. And so we'll be calling upon these same partners and other health-oriented agencies to work with these different problems that we see in Huron County.
Okay. So let's say 3 years ago, smoking was really big.
Yeah.
Obesity was not.
Yeah.
And if they've switched, so more of your input now, you can go ahead and put into this other area now, right? And maybe not as much into where you succeeded, or do you defeat the purpose then?
That's a great question. And I think that's why a health assessment is so important, is because resources are limited.
Right.
And probably never more so than they are right now in my lifetime.
Sure.
So you want to be very judicious
Okay.
with the way that you appropriate your staff's time, your agency's money. So yeah, one of the things we have to look at is, are there things we assumed were problems that maybe are not problems here? Or is that a number that we're keeping where it is by what's being done now, and we
Right.
should continue that?
Yes.
Where are we desperately in need of putting more energy? And
Okay.
so that's how this is supposed to be used.
Okay.
You can use it to get grants
Okay.
a lot of times.
Okay.
And it also informs people who have to make policy, set budgets. That's the intention of the survey.
Okay. Again, I want to mention that when you're done with the show, you're going to sit down with Aaron Krause, and
Yes.
Aaron's going to do a nice article that'll have a lot more numbers in them, so people, if they happen to miss numbers that we're talking about today,
Oh, yeah.
they're going to be in the. Plus, we do want to mention this whole book is on the website.
It is. If you go to www.huroncohealth.com, that would stand for Huron County Health. It's just abbreviated, but with no period. You can click to see the assessment report in its entirety and read it for yourself. And if you're a visual learner like me, that would be preferable than trying to take it in, listening to us talk about it today.
Okay, let's just go over some of the ones that I kind of looked at last night. We have health status perceptions, health care access, health care coverage.
Yeah.
If you can, let's kind of just combine those three and kind of
Sure.
what you found out from the people that replied.
Okay. First, a little verbiage. Health status is how healthy do you feel? How many health problems do you have? And that looks at physical and mental health. Healthcare access or coverage is when you need health care, can you get what you need? Now, the biggest barrier to that is oftentimes lack of health insurance or health care coverage. And so a little bit of the basics of what we saw there in terms of how healthy people in Huron County feel. Over half of our adults rated their health as excellent or very good. This was better than both the Ohio and the U.S. rates for that measure. So we
Okay.
feel healthier than our counterparts
Okay.
throughout the state or nation. That's the good news. 12% of our adults rated their health as fair or poor. Residents who rated their health as excellent or very good did go down by 2 percentage points from when we did this in 2007 to when we did this now. So that's a little bit of a concern there, and we'll want to take a look at maybe what's accounting for that.